How long does it take to recover from a total knee replacement? How can I speed up my recovery after knee surgery? How long does it take until I'm able to return to driving after a knee replacement? And how painful is a knee replacement? These are some of the most common questions we hear from people who are preparing for knee surgery and who are looking to get the best possible outcome from their surgery. In this video, we're going to talk through what to expect following knee replacement surgery and what you can do to give yourself the best possible outcome. The decision to have knee surgery is a big one, and you'll no doubt be thinking about the procedure, but also about planning around your recovery and what you're going to need to prepare in the weeks and months following surgery. I'm Mike, one of the lead physiotherapists here at Circle Reading Hospital, part of Circle Health Group, the largest independent healthcare provider in the UK with hospitals and rehab units across the country. Your physiotherapy team will help you through your recovery from surgery, but the majority of work needs to be done by you. Recovery from knee replacement surgery requires your commitment and dedication to make sure your knee recovers as best as possible. You're signing up to a full-time job of exercise, and we're going to explain why. People often aren't aware that the first time they'll speak to their physio will be before their surgery. As soon as you have made your decision to have surgery, you'll be booked in either as a face-to-face appointment or to speak to the physio over the phone. The physio will explain everything in detail, and you'll have a chance to ask any questions about your recovery and rehabilitation. If you're able to, we'll start you off on some simple exercises ahead of your surgery. So when it comes around to doing the same movements after your procedure, you'll already be familiar with them. This saves you having to learn new movements while you have pain and swelling following your procedure. In the days following surgery, while you're still in hospital, pain levels will be at their worst. The physio team will apply ice to your knee, and the priority initially will be making sure you're able to extend your knee out straight. Pushing through discomfort at this point is going to be the hardest, so your physio will remind you that you're not to be frightened of the pain. This is a very normal part of the process. You'll also need to try and eat enough and stay hydrated, even if you're feeling a little off. Painkillers and disruption to your usual routine can make this difficult, but it is important to ensure these items are met. You'll start your physio almost straight away. Your physio will show you how to get up out of bed, walk with a walking aid, and shower before you go home. The role of the physio is to give you the confidence to move your knee, to be able to get up and moving about, including getting up and down stairs, so that you're safe to go home around day 2 following your procedure. You'll have all of the guidance and different exercises written down, so there's no need to try and remember everything off the top of your head. The first few weeks at home will be challenging. You'll still be on painkillers at this point, but you will be able to stand up with little or no help, go on short walks, and rely on your crutch or walker less. The aim from this point going forwards is to gradually build strength and flexibility until you get back your full range of movement and have the same, if not more, strength in the joint as the scar tissue begins to heal and the swelling begins to subside. By a couple of weeks in, pain levels will be improving. We'd recommend doing your exercises very often, every hour or so, in order to stop your knee getting stiff. We want to keep it moving. We have videos on our channel talking through different kinds of exercises in detail, so you can always check back on these at a later stage. At this point, many people are up and about and beginning to enjoy activities like golf, walking, and cycling. If you're committed to your physio, the sooner these goals can be achieved. Sometimes it can take 3 to 6 months, or even up to an entire year, to fully recover and get the total benefit of your knee replacement. This is well worth you investing in your full recovery throughout the year, so it's all worth it in the end. Maintaining a healthy weight and staying active in the years after your total knee replacement is something you should enjoy, but it will also prolong the life of your new joint. If you're recovering from your knee replacement surgery and you have any helpful tips or thoughts on the ways you've found to stay committed to your recovery, then do share them in the comments section below. So that was an overview of what to expect following your total knee replacement recovery. If you want to find out more or book a physiotherapy session here at Circle Reading Hospital, you can call directly. You can book online via the link in the description below, or search the nearest Circle Health Group hospital in your area at circlehealthgroup.co.uk. If you have any questions on anything we've covered in this video, or would like a video on recovery from different types of treatments or problems, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.